All right, everybody, Dr. Rayford from Vet Triage. We're continuing through Veterinary Surgery, November 2024 edition. We're going to be talking about canines today. The mucosal graft urethroplasty in 5 male dogs with penile urethral strictures of the bulbus glandis. So right off the bat, 5 male dogs, not a large number, unfortunately, but typically when you have a novel surgery like this, it's hard to accrue the numbers that you'd like to see. This study comes out of Thailand and Tokyo. The objective is to evaluate the feasibility of correcting penile urethral strictures at the bulbus glandis using a buccal mucosal graft, urethroplasty in dogs. Prospective clinical trial. So that's pretty cool. That's prospective. Yeah, and it's a little suspicious, but that's fine. It's suspicious because it's not the kind of disease you can plan for. These cases come in sporadically, but I guess they must have thought that they can get the numbers ahead of time randomly. So I don't know. Methods. Urethrotomy was performed throughout the entire length of the stricture, including 0.5 centimeter of healthy urethra, proximal and distal. The scar tissue and unhealthy mucosa was excised. The graft was harvested from the buccal mucosa, so this is from the inside cheek. They took that tissue, tubularized it at the stricture site using a urethral catheter as a skeleton. The catheter was then maintained for 2 weeks after surgery and then removed when no urethral leakage was identified on post-contrast retrograde urethrogram. The dogs recovered well. They all urinated fine. 2 weeks after surgery, they did a post-operative retrograde positive contrast urethrogram, and then had a medium follow-up time of 182 days. All dogs did great. Introduction. Urethral stricture is a common consequence of injuries from urethrolyths or urethral catheterization or other trauma like pelvic fractures or surgical injury. Strictures caused by congenital diseases or chronic urethritis is also observed. Dogs with stricture often show stranguria, prolonged urination, plaquuria. Retrograde positive contrast urethography or urethroscopy can help diagnose. Surgeries reported before for this condition include urethral resection and primary anastomosis or urethrostomy. Urethrostomy can be penile, scrotal, or perineal. Scrotal is preferred because it's superficial, minimal complications. In humans and dogs, urethral balloon dilatation and stent placement are alternatives. The main complication with that is recurrence of the stricture, incontinence, weak urine stream, urethral trauma. The most frequent complication with stents include granulation tissue. Recurrent stricture, stent fracture, stent migration, and tumor ingrowth have also been reported. Various autologous tissue grafts have been used in people. Several complications with graft include stricture, fistula, stones, hair regrowth, and graft contracture. Bladder mucosal grafts have been associated with complications such as recipient site mucosal prolapse, bladder epithelium protrusion, causing meatal stenosis, and urinary obstruction, delaying wound healing, and the requirement for complex technical procedure to harvest the graft. The mucosal graft has been one of the techniques commonly used for humans with urethroplasty. Materials and methods. So they performed blood work, but the blood panels didn't have all the parameters that we would have in the States, or maybe even North America in general. So right off the bat, it could have been worked up better. It probably doesn't matter for these cases, but still. Surgical procedures: morphine, alfaxalone, isoflurane, fentanyl, cephalexin. Dissection was continued through the subcutaneous tissue and the prepucial mucosa to expose the penile shaft. The bulbus glandis and corpus spongiosum were incised ventrally to expose the urethra. Urethrotomy was performed, opening the urethra over the stricture site and 0.5 centimeter proximal and distal to it. The scar tissue and unhealthy mucosa was removed. The length of the stricture site and the width of both healthy urethral ends were measured to determine the optimal mucosal graft size required for augmentation. And so here you can see pictures, very cool surgery where they incise the urethra and then remove the scar tissue, place the catheter. This black area is the graft. So it's black because the dog's cheek is black. That's why it's dark colored. And then they close it over it. And then here's the final incision. Graft harvest and application. During harvesting, the parotid and zygomatic papillae were identified to avoid injury to the orifices and ducts of these glands. To account for the contracture rate of the buccal mucosa, the dimensions of the harvested graft were increased by 10% compared with the previously measured size of the urethral stricture area. And then the cheek was allowed to heal by second intention. Urethral reconstruction. The buccal mucosal was secured using simple interrupted suture pattern with intermittent tacking of the underlying corpus spongiosum and bulbus glandis. After surgery, clavamox, morphine, carprofen, retrograde positive contrast study using iohexol, diluted 50-50 with sterile saline at a dose of 5 mL per kg. And then ultrasound as well. All dogs were discharged 3 days after urinary catheter removal to confirm urination spontaneously. They were hospitalized for 17 days. Follow-up, positive contrast retrograde urethroplasty was performed at 6 months. Owners were interviewed, and they used the American Urological Association Symptom Score questionnaire, modified version, which asks about frequency, intermittency, inconsistency, and weak stream and straining of urination. The scores were 0 to 5. 1 to 5 was excellent, 6 to 12 was good, 13 to 25 was poor, and then also quality of life score with responses varying from delighted to unhappy. Results. For the animals, definitive diagnosis was based on retrograde positive contrast urethroplasty using iohexol. Removal of the urethral calculi was in 4 out of the 5 dogs. Urethral reconstruction outcome. A urine output was found for the dogs between 1.43 and 1.90 mils per kg per hour. Normal is 1 to 2 mils per kg per hour. Here is the contrast study. So in the picture on this side, the arrow is pointing to the stricture, and then the other side is the arrowhead is the surgical site, and the full arrow is a normal urethra to compare it to. Median follow-up 182 days. Mean percentage decrease in the adjacent urethral luminal diameter was 10%. The dogs had a score of 0, meaning normal urination. Excellent score index values obtained for each dog. Overall, the quality of life was delighted. Discussion, which, very dumb. I mean, again, to say just delighted just sounds dumb. It's just so stupid. It's very gimmicky. So, I would prefer to use some sort of medical terminology or something that's a bit more accepted. But delighted is bizarre. It's very weird. Discussion. One minor complication, which was bruising and swelling. No major complications. The location and size of the stricture resulted in difficulty in providing correction in these dogs because the structure was located at the ventral groove of the os penis, where the penile bone restricts urethral expansion. These factors limit urethral mobilization for anastomosis. A scrotal urethrostomy is chosen for stricture in this area and is associated with minimal side effects, including hemorrhage and stricture. However, you have to neuter the dogs, which some owners don't want to do. And half of these dogs were not neutered. I think like 2 or 3 of them were not neutered. The successful use of nitinol urethral stents for the treatment of traumatic penile urethral strictures in dogs has also been reported. However, limited urethral expansion due to physical restrictions associated with the os penis, development of polypoid tissue, and restenosis at the stent ends have been reported as complications. The mucosal graft was chosen because excellent features, such as the histologic characteristics, include thick and thin epithelia that are well organized with vascularized lamina propria, making this tissue suitable for graft acceptance at the embedded site. The elastin in the thick epithelium provides graft durability and facilitates graft handling. Furthermore, these grafts are easily harvested, they're hairless, they can tolerate urine and infection. The similar composition of the buccal mucosa and urethral mucosa means that the graft can be easily attached to the urethral bed. The adjustment in the size of the graft relative to the defect was based on an approximate contracture site of 8.4% in length and 9.5% in width, as observed in buccal mucosa. That's why they went with 10% larger size than needed for the urethra, because they knew there was going to be some contraction. In human urethroplasty, these grafts are categorized as 2 types, either patch graft, which include onlay and inlay, and tubular grafts. Onlay and inlay techniques is that the inlay technique graft is spread and fixed over the urethral plate. Tubular grafts often fail due to inadequate graft take, as they are not circumferentially surrounded by vascularized tissue, resulting in a relative deficiency in blood supply. despite adequate dorsal and ventral support. Thus, owing to greater blood supply, patch grafts provide better outcomes than tubular. The three most common approaches for bulbar urethroplasty utilizing grafts are dorsal, ventral, and lateral aspects of the penis. A ventral technique was used here because the superficial position of the affected urethra and the absence of the retractor penis muscle. Surgical access to the urethra using this approach is also facilitated by the absence of urethral obscuration by the os penis, which is anatomically different from that of humans. Furthermore, there is little cavernous tissue and no bulbospongiosis muscle surrounding the urethra in this region, which minimizes hemorrhage. Successful use of gauze tied around the base of the penis and caudal to the bulbus glandis has been reported, as it may provide a tourniquet effect, making it a potentially beneficial option when used in conjunction with the graft urethroplasty to minimize intraoperative bleeding. So yeah, I mean, overall a good study. It's a good case series, and helpful for those veterinarians that may diagnose this condition. You can take a stab at this if the owners are willing to do it and the other options mentioned in this paper are not viable for you and for that case. And for pet owners, this is usually when there's multiple surgeries or techniques to fix something, it typically means that it's a frustrating condition and we don't have a good answer for it yet. So urethral disease in general is one of those locations anatomically that are always difficult. So, all right, we will see you guys again in the next video. Thanks. Bye-bye.